Now we're going to move into some lengthening tests and measurements for the lower body. So the hip, the knee, ankle, and foot. So we're going to start with the hip. So the hip does a couple different actions. It does flexion, extension, abduction, adduction, and then internal and external rotation. So I picked 3 muscles to cover for the hip. So we're going to start with the tensor fasciae latae. So it originates at the iliac crest. That scared me. It originates at the iliac crest, posterior to the ASIS, and then it inserts into the IT tract. So it kind of turns into the IT band. It does not perform passive and active insufficiency because it's not a 2-joint muscle. So the actions that the TFL do, they do flexion. It does, and internal rotation. So for those, I'm going to do special tests for both of those movements. So the first test we could do for TFL is we could do the Thomas test. So I'm going to have Angelo go ahead and lay on your back. So for this, this special test is going to test the tightness of his TFL on each side. So I'm going to have him go ahead and you're going to hug your left knee to your chest. And then this leg is going to, so maybe scoot this way a little bit. So that way this leg,
out.
Yeah.
Okay. Or do you want a taller table?
Yeah, we're going to have to move to a taller table. So we're going to use this table here. We'll go in here. Okay, so
we'll do my left side then?
Yeah.
Okay.
So he's going to go ahead and lay on his back, and he's going to hug his right knee to his chest. Oh, what about you? So go ahead and hug your knee. So for this, I'm looking to see if this leg is able to be flat. It looks like it's pretty flush to the table. If his leg were to be up here, then that would kind of indicate a tight TFL on the left side. And we're going to go ahead and assess the other side as well. Okay? So go ahead and maybe put your head that way so they can see. Okay, and then you're going to hug this side. Yeah, so it looks like he doesn't have any tightness on this side that is causing his hip to be in a more flexed position. So that's the Thomas test for that one. If we did need to stretch his TFL in that position, he could do a hip flexor stretch. So I'll have you go ahead and stand up for a second. And then he can just do a standing hip flexor stretch. So he can go here, kind of in a lunge, and then going into a posterior pelvic tilt. So he's stretching out his left TFL there. So we're just going to hold that for 30 seconds. We'll just do the rest of them in here.
That's fine.
Okay, so the TFL also does internal rotation of the hip. So I'll go ahead and do another special test for that one, just to assess. Or you can go ahead and relax on the stretch. So this special test is called the Ober's test. So I'm going to have Angelo go ahead and lay on your side, either side. Because we're going to do both.
This way?
Yeah.
Okay.
Okay, so the Ober's test is another test for the TFL. Yes, so what we're going to do, so I'm kind of taking his leg here and pulling it back kind of into extension here. So I want to make sure his hips and his shoulder and everything are in alignment. So I'm pulling it back here. And then if I were to kind of let go here, if his TFL was really tight, his leg would not go down. So I'm going to have him just try to relax as much as you can. Okay?
Oh.
Are you relaxing?
Yeah.
So if your leg wants to drop, just let it drop. so. He does have a pretty tight TFL, according to the Ober's test, because his leg is not really dropping here. So his TFL that does the fibers that do internal rotation could be pretty tight on the left side. So let's try the right side. So you can have your head facing this way. Okay, and then we're gonna bring your knees back this way. Here. Okay. So we just want to make sure we have everything in alignment. And then we're gonna go here. We're gonna come back into hip extension a little bit, and I'm in a little bit of internal rotation because I have his leg supported here, and then I'm gonna go ahead, and it's pretty tight on this side too, because even if I feel the IT band here, it's very, very, very tight. So, and it's also not allowing his leg to drop down. And then another way we could test that is straight leg here, making sure he's not opening up at the hip, and then so kind of different results. He could have a little bit of muscle burning, but that's how you test the TFL in a different way. Okay, so that was that TFL. We did the hip flexor stretch. Okay, so now we're gonna move into glute max. So glute max does extension, abduction of the hip, as well. Just extension and abduction of the hip, and external rotation of the hip. So if I wanted to lengthen his glute max, you can go ahead and lay it on your back. You can lay on your back.
Sorry.
On your back.
Sorry.
And then if I wanted to do, we could just do a knee to chest stretch. So since the fibers of the glute perform extension, we're going to lengthen them into flexion. So we're flexing the knee and the hip. So you can hold that for 30 seconds. You can either do this one each side at a time or bilaterally, so double knee to chest.
Can I just do both?
Yeah.
Okay.
He prefers to do both. Good. So you can have your patient hold that for about 30 seconds. So the origin and insertion for the glute max, it originates at the coccyx and the edge of the sacrum. It also originates at the posterior iliac crest, and then the sacrotuberous and sacroiliac ligaments. It inserts into the IT tract, the gluteal tuberosity, and it does not perform passive and active insufficiency. Okay, so that was 30 seconds. You can go ahead and relax. The glute max also does abduction. So if I were to lengthen those fibers that perform abduction, he can kind of we could do a passive range of motion for adduction. So go ahead and relax your leg. So you can go here, and we can come across and back. Good. So putting those muscles into adduction would lengthen those fibers of the glute max. The glute max also does external rotation. So external rotation. So it goes here. So in order to stretch that out, you would just put his leg into internal rotation. So a way we can do that, you can go ahead and stand up really quick. I'm going to grab a stool. So this is a way to kind of get the glute into internal rotation to lengthen the externally rotating fibers. So if it does external rotation, you can kind of have a stool and then go here and back. So this would not be a static stretch. It would be more of maybe a ballistic stretch since it's continuous or dynamic. So just getting more blood flow into the area. So you can go ahead and try.
So you want to go external, right? Like you said?
So you want to go internal rotation. So your foot's going to come out, yeah.
Ooh.
Good. And then just keep going for reps on this one. So now his hip's going into internal rotation. Good. Okay. So, last muscle of the hip that we're going to go over the muscle that performs adduction. So we're going to focus on the adductor magnus. So that originates at the inferior ramus of the pubis, the ischial tuberosity, and then it inserts into the medial lip of the linea aspera, the adductor tubercle, and it does not perform passive or active insufficiency. So if I wanted to go ahead and stretch out the adductor muscles, I would have Jello go into more of an abduction movement for his hips. So we're going to come out over to the turf for this one. So a good adductor stretch, kind of depending on the level of your patient, is he can go here, and then he can kind of do a side lunge and sit into it and stretching out these adductors here. So we'll do this as a dynamic stretch. So instead of holding it for 30 seconds, he's just going to go here, stretch, and then go to the other side. And we'll do that for about 30 seconds, back and forth. So as he goes to this side, his left adductors are lengthening. So you should feel it in his inner thigh. And then now the right adductors are going into a lengthening position. You have 5 more seconds. Okay, you can go ahead and relax. Okay, now we're going to move into the knee. Come back in the room. We're going to move into the knee. So the movements that we're focusing on for the knee are just going to be flexion and extension. So the muscle that I picked that flexes the knee is the biceps femoris, so one of the hamstring muscles. That originates at the ischial tuberosity, and then it inserts into the head of the fibula. It does perform passive and active insufficiency, so I'll go ahead and show you what that looks like. I'm going to go ahead and, so I'll have Jello perform it. So active insufficiency of the biceps femoris is going to be knee flexion as well as hip flexion.
So knee. Okay, and then knee flexion.
Actually, it's going to be knee flexion, hip extension.
So knee flexion.
And then hip extension.
Ooh.
So that is going to be active insufficiency because this is activated, and then also we're going into a little bit of hip extension. So if we wanted to totally lengthen and put the biceps femoris into a passive insufficiency, I would have Jello go ahead and lay on his back. And then he's going to go into knee extension, so go ahead and straighten out your knee, as well as hip extension. So this is passive insufficiency because this is totally lengthened here. Okay, so a test for lengthening of the biceps femoris. We're going to do the 90-90 hamstring special test. So what you're going to do, first you're going to go into hip flexion. So we're going to go here. So you're going to grab with both of your hands.
Okay.
And then I want you to try to straighten out at the knee as much as you can.
You mean like?
So try to straighten your leg.
Oh, straight out like that. Okay.
Good. And then you can go here. Good. So it looks like he's pretty good. If I really wanted to be specific, I can grab my goni Go ahead and yeah. So right now he's at 30 degrees of knee flexion. And then I'll have you do it on the other side. Good. Okay. So now I'm gonna measure here. And this one is 20 degrees. No, it's at like 22 degrees of knee flexion. So the left side's a little tighter. So if I wanted to put the biceps femoris into a stretch to lengthen that out, I'm going to have Jello go ahead and sit up at the edge of the table. I'm going to go ahead and lower the table so that his feet are on the ground. So what he's going to do, we're stretching out that left side. So he's going to bring his left leg straight, flex his toes towards him, keeping his back nice and flat. He's going to hinge and stretch out the back of his hamstring. And I'll go ahead and set a 30-second timer.
Dang, this is really tight.
Yeah. So when a patient is doing dynamic stretching, you also want to make sure that they're taking nice deep breaths. That way they're able to relax more into the stretch. So after he does 30 seconds of this, I'm going to go ahead and take another measurement to see if it kind of helped extend those muscles a little bit. Good. Okay, go ahead and relax and go ahead and lay on your back again. Good. So go ahead and do that same thing. So where you're going to grab the back of your knee and then come up. Ideally, we'd want to do at least like 3 sets of that, but we'll see. Visually, it looks like he gained a little bit of range of motion. And then as far as the goni, it's looking at like he's at 12. So we were able to gain some range of motion from that stretch, that lengthening stretch. So now we're going to move into the flexor, the extensor of the knee. So that's going to be the rectus femoris. This is a passive and active insufficiency muscle because it crosses over 2 joints. So it originates at the AIIS and inserts into the tibial tuberosity via the patellar ligament. If I were to put the rectus femoris into passive insufficiency, he would be, I'll do that then. So I'm going to do a test for the rectus femoris. I'm actually going to do a lengthening for his rectus femoris. So I'm going to have you go ahead and go prone. So I'm going to have you go ahead and reach your heel towards your butt. Good. So this, I can take a measurement here, a goni measurement, to see the lengthening capabilities of this quad. But we also want to keep in mind if your patient does have really like big hamstring muscles, that could be a limiting factor. So I'm going to go ahead and measure here, lining up with his lateral now. Let's see. So right now we are at 58. Now I'm going to go do the other side. Okay. Now go ahead and do it this way. So we're at 58 on that one. This one we are at. This one we're at 61. So it looks like this one is a little bit tighter. So if I were to have Angelo stretch out his quad, his rectus femoris, I'm going to have him stay in that position and I'm going to grab him a stretching strap. Okay, so Jello can go ahead and be prone, and then I'm going to put the strap here on his foot. I'm going to pull here, and he can grab here and pull. So that's like a self-stretch, a static stretch with the assistance of a stretching strap. So we're going to hold that for 30 seconds. can go ahead and relax. As far as active and passive insufficiency for the quads, no, you're good. For the quads, active insufficiency would be knee flexion as well as hip flexion. Knee extension as well as hip flexion. And then passive would be knee flexion, hip extension. So it's like kicking a ball for that one. Okay, so those were the knees. Now we're just going to finish off with ankle and foot. So moving into the ankle, we have a couple different movements. We have dorsiflexion, plantar flexion, inversion, eversion. So I picked a couple muscles for this one. First muscle is tibialis anterior. Tibialis anterior performs dorsiflexion. It also performs inversion of the ankle. And then we have tibialis posterior. That performs plantar flexion, so like a heel raise, and then also, that's it for that one. And then I also picked fib longus, or peroneus longus. That performs eversion of the ankle. So we're going to start with tib anterior. So that originates at the lateral epicondyle of the tibia, and then it goes and also originates into the proximal lateral surface of the tibia, the interosseous membrane as well, and it inserts into the medial cuneiform and the base of the first metatarsal. It does not perform passive or active insufficiency. So if I were to assess Angelo's tib anterior as far as dorsiflexion, I'd have him go ahead and sit on the table. I'm going to raise this a little bit, and I'll take a goniometric measurement. Okay, so I'm going to have Angelo go ahead. I'm actually going to do this a different way. I'm going to have him go against the wall.
Back in the wall?
No, I'm going to have you do like a calf stretch on the wall.
Okay.
Yeah, so I'm going to...
I don't know if you can see this thing.
Okay. So go ahead and go here and try to have your heel... Have your heel... So I'm going to assess what Angelo can do as far as dorsiflexion here. So he's at about 21 degrees of dorsiflexion. The normal range is 20, so he's good on that foot. Let's try the other foot. So same landmarks here. So this one's at about 31. No, 30. So this one's a little tighter. So if I were to have Angelo stretch out his anterior tib for the left side, he can kind of be against the wall still. So if I were to lengthen it, he's going to go into more of a plantar flexed position. So he can go here, having the dorsal part of his foot, and then kind of leaning forward.
Okay.
So really trying to, you can kind of bend the knee even.
Bend it? Okay.
And so he should feel a stretch like
Yeah.
in his anterior tib. So we're gonna hold that for 30 seconds. And then I'll take another measurement. Are you okay with taking your socks off for the next one?
What's up?
Are you okay with taking your socks off for the next, or the feet?
That's fine.
Okay, so you can go ahead and relax. Now I'm going to go ahead and take that measurement again. So I'm going to have him go into like a calf stretch on the left leg. And you also want to make sure when you take the measurement that their heel's not off the ground. So his is good. So now... 29 now. So he was able to gain a little bit of dorsiflexion. He has enough dorsiflexion to be functional as far as like gait pattern, but it is something that could still be worked on. So now we're gonna move into, tibia anterior also does inversion. So I'll show you what it looks like to put it into a lengthened position for that movement. So you can go ahead and sit down. So if tib anterior does inversion of the ankle, so it helps with that as well as dorsiflexion. If he wanted to put it into a lengthened position, he would go into some eversion and plantar flexion. Yeah, so that would lengthen the anterior tib there. So now moving into the tibialis posterior. So that's a plantar flexor. It originates at the proximal posterior shafts of tibia and fibula, as well as the interosseous membrane, and it inserts into all 5 of the tarsal bones and bases of 2nd through 4th metatarsals. It does not do passive and active insufficiency. So tib posterior does plantar flexion. So so actually the measurement that I just did was actually more appropriate for plantar flexion because I'm stretching out. Actually, no. 1 second. So tibialis posterior does plantar flexion. Yeah, if I wanted to do a lengthening measurement of the tibialis posterior, that's actually going to be the stretch that I just did. So if I wanted to do, the calf stretch. So if I wanted to do a lengthening measurement for the tibialis anterior, I would do a plantar flexion goni measurement. So I would actually have you go ahead and plantar flex your foot. So go ahead and start at neutral first. So neutral, we're starting at like 80 and then go down. We're ending at like 15. So 80 minus 15. So you got 65. Norm is 70. And then we're going to do the other side. So is that neutral for you?
Yeah.
So we're starting at, start at neutral?
Oh, sorry.
So we're starting at, and then go to plantar flexion. So he has a lot less plantar flexion here. Okay, we're gonna go ahead. So the lengthening stretch for posterior tib would be the calf stretch that he just did. Lengthening stretch for the anterior tib would be the stretch that he just did. I just kind of mixed it up, but we're just gonna keep going. So, fibularis longus originates at the head of the fibula and the proximal 2/3 of the lateral fibula. It inserts at the base of the first metatarsal medial cuneiform, and it does not do passive or active insufficiency. The actions that the fib longus perform are eversion of the ankle. So, eversion of the ankle. So, if I were to put that muscle into a lengthened position, if it performs eversion, so here, I would have it go into inversion. So that muscle lays right in here. So if I go into inversion, I'm lengthening it here. Okay, so now we're going to move into the feet. So as far as the feet, we have 2 different actions. So we have flexion and extension. So flexion and extension, I chose the lumbricals of the foot because they are able to do both. They're deep muscles of the foot that can do both flexion and extension. They originate at the tendons of the flexor digitorum longus, and they insert into the base of the proximal phalanges of toes 2 through 5, as well as the extensor digitorum longus tendons on the dorsal surface of the toes. So They do not perform passive or active insufficiency. So for this one, I'm going to have Angelo go ahead and lay on his back. And are you okay with taking your shoes off?
Fine.
You can leave your socks on if you
That's
want.
fine.
Then have him mess with the other one.
You sit back.
Yeah. Okay, so if I wanted to, for this one, I'm just going to kind of do an observatory measurement. So if I were to passively do a passive stretch for Angelo, we're going to take the flexor fibers of the lumbricals, and I'm going to lengthen them into extension. So I'm going to kind of grab here, and then I'm going to pull back. So as you can see, I'm not really focusing on ankle. I'm more so getting the deep muscles of his foot. So here, I'm kind of getting the plantar fascia here. So that one, he feels pretty flexible. And then here, I'm going to pull here. So I'm kind of stabilizing at his calcaneus. Pulling. Okay. And then as far as stretching out the extensor fibers of that muscle, I'm holding here. Then I'm going to have him kind of flex his toes. He does feel pretty tight here, so I can kind of make that observation. He feels pretty tight on this side. Does that feel tight too?
Yeah, feels pretty tight.
And then this side here. The left side seems a lot tighter. Yeah. So if I wanted to have him stretch out these at home on his own, he could do that same stretch that we used for stretching out the anterior tib against the wall, stretching here, or we can do like a passive stretch here. So making sure that I'm stretching here as well as the dorsal part of the toes, because that's where it inserts.